Hello, everyone. Dr. M here. Welcome to the Peace Driven Leader Lounge. I have none other Miss Camille Mcdaniel with us on today. Thank you so much for sharing this space with me. I really appreciate
Absolutely.
it. We're
Absolutely.
in for it. You all are in for a treat. We're going to have candid conversations. You know how this podcast is, where we are pulling leaders from the top of the industries and really taking a chance to listen to their heart when it comes to what it means to be a peace driven leader and what that looks like in real life. And so I'm really excited to be able to have a conversation with you. This is a busy world. It's noisy, it's loud. We have people that are listening that are moms and wives and husbands, parents, daughters, and they don't want to just show up and just live a regular life. They want to live an extraordinary life. They don't want to have to choose. They want to be able to have a beautiful marriage and a harmonious home, and they want to be able to excel in the corporate space. And so this is like a sacred environment where we get to have real conversations that matter with real people who really believe in leadership done the new standard, and that's in a peace driven way. That's the new standard of leadership. So we have you on because we know you've been drinking that juice too. You understand, right? You get it. And so I don't believe that no one can quite introduce themselves like themselves. And so I would love for you to spend like the first couple of minutes just kind of sharing with us who you are and the type of people you serve, and especially from a corporate standpoint. I would love to hear just some of the work that you've done in the corporate space, and then we'll go ahead and jump in and get started with the conversation.
Thank you so much for having me. I am Camille McDaniel. I'm a licensed professional counselor and I'm located in Georgia. And so, what I do in my counseling practice, because I have actually, I guess, I'm an entrepreneur, if you will, because I have a counseling practice, and that is where I serve my clients who are coming to me and for a variety of reasons, actually. Some of them
Okay.
are coming from a more corporate space where they're dealing with everything from burnout to high expectations of the company that they serve and trying to juggle those high expectations, but also trying to juggle personal life expectations.
Right.
Some individuals are also in the middle of like the sandwich generation where there's a lot going on in their world as they are corporate and they are parents and they are also taking care of elderly parents as well.
Mm-hmm.
And then there are other clients that come for things associated with stress and anxiety and feelings of deep depression. And some of those clients also ask that their faith be integrated. So I do specialize in Christian faith integration within the counseling setting as well.
Oh,
Uh,
wow. That's
and
awesome.
and so that's in my counseling practice, healing psychotherapy practices of Georgia. And then another area of my entrepreneurship is being able to support clinicians, mental health professionals.
Mm.
And specifically, my road is helping them to ethically and professionally integrate their faith into their private practice if they happen to have clients who are coming with a worldview that is Christian and they want that integrated. I help a lot of those clinicians to understand how to do that ethically and professionally without having to sacrifice or forfeit their own faith beliefs as well.
Yeah, that's awesome. I think that's a really great way to kind of open up the conversation when it comes
Mhm.
to just religion and the work that you do, because I know that that has been like a big misnomer for many years,
Yes.
and I just had a conversation with a friend of mine, and she also works a lot with our clients. And for me, when I look at the importance of being able to respect where people are,
Mhm.
sometimes it gets a little convoluted when you're like, you as the therapist, the professional, is having to withhold your authentic self,
Mhm. Mhm.
and having someone tell you that in order for you to stay in the confounds of this license, you have to resist your natural nature. And so I really
Mhm.
love that you have found a creative way to show people how to do that,
Mhm.
ethnically and legally, because I do think it's important for every everybody, that has a value or a standard that they believe, for
Mhm.
us to be able to make space for that. And not in a way if it's right or wrong or agree or not, but just make room for
Yeah.
that part of their journey, you know?
Absolutely.
And so
Absolutely. We serve clients, we serve the whole client, mind, body, spirit. Many of us believe there is value in recognizing that. And as professionals, we also need to make sure we're showing up wholly in totality,
Mhm.
mind, body, spirit. And so,
Absolutely.
there are ways, and the main thing that really, before we do any kind of counseling, is to make sure that our clients are fully informed of who they are going to come and see. Some clients want to see a male, some want to see a female, some want their counseling session spoken in only a certain language that is comfortable
Mhm.
for them. Some want somebody who is from their same culture background, and some want people who are familiar with and can integrate their faith. There are so many different specializations in our field that go even outside of the mental health specifically, like specialization in an eating disorder or marriage and family therapy
Mm.
or children and adolescents. But we can take it a step further, and some people specialize in counseling in a certain language. Some people specialize in counseling for certain cultures they're very familiar with.
Wow. Well, this is really good because for the first time in my
Mhm.
adult life,
Yeah.
I'm a big advocate of therapy. So I have always kind of, I would say in the last 12 years, I've always been consistent with going to therapy. And for the first time just recently, I actually interviewed several of therapists. And I don't know what your thoughts are about that. And I would love for you to kind of share what you feel would be a good practice when you're thinking about therapy. Because for many years, I just saw you go to therapy almost like, maybe a doctor or something, but then
Yes.
it's like, oh, everybody's kind of doing the same
Mhm,
thing, let's just
mhm.
go, let's see who's close to my house and let's just
Right.
do it. But now I
Yeah.
realize, and what I wanted, I don't know if this is, your a good standard practice, but I actually went in like, let me find a person on the most opposite spectrum of me.
Mhm.
Like way opposite so that I can, because what I was looking for was like perspective, different perspective. So I
Yeah.
actually went the opposite culture, the
Yeah.
opposite gender, the opposite, maybe even religion. You know what I'm saying?
Yeah.
Like literally, I just went the opposite. And that was the most profound season of my
Yeah.
life
Mhm.
because I think
Oh,
sometimes we limit ourselves just by because we think it's alignment, oh, it's like
yeah.
me and me. Oh, so we just automatically just assume that that's alignment. So talk to me about what you feel like the general practices is when you're out there, you get to that point where you're open-minded enough to say, hey, I would be open to talking to someone. What are some things that we should be thinking about?
I think you hit something on the head in that underlying whatever you were going to counseling for, you had a desire for a different perspective. And you didn't want to just have the same. You could get the same anywhere, but when you wanted to venture into a counseling space, you at the base of it was saying, I would really like to find out what other people think outside of my comfortable circles. And
Yeah.
so that's where we start. What is it that you really
What do you
desire? You,
want?
you
What do
know,
you want? I like
Mhm.
that.
What do you want? And there are many different specializations in the field of mental health, just like you mentioned, going to a doctor, but we know what doctor we need. Do I need a pediatrician or do I need a cardiologist? And
Mm-hmm.
so thinking about mental health in the same way. And we don't
Mm-hmm.
all specialize in the same thing, actually. But I know that on the outside, it really does seem like it's a therapist. Like, so I'm going to get therapy. Don't you all do the same things? Right?
Yeah, literally. I mean, I'm telling you,
Right.
for years, it was like there, it's a therapist. You're a therapist. Okay, cool. It's
Mhm.
almost like a dentist and so well, let me ask you this. Is it safe to say that if I'm a woman and I'm a wife and I have children, do you believe that a therapist who may specialize in, let's just say, eating disorders, but she's not a wife, she's not a mom, and she's
Mhm.
not a kid.
Mhm. Yes.
Um, would you say that still could be a good fit? Because sometimes I think, I'm always about integration. Like these
Yes.
these these
Yes.
experiences could help and broaden her insight. So when
Yeah.
it comes to you all's education, do you
Mhm.
all, and you get licensed in that whole process, do you all have lessons or topics or discussions, where you're getting these insights outside of your own personal experience so that you can be more versed when it comes to your clients?
I love this question. I have thought about this question because this question has come up over the years that I've been doing this. I got licensed in 2005.
Oh, wow.
I have had time to really think through this
Mhm.
because it has come up. And I think that where we start is, first of all, we all have similar foundations when it comes to getting our degrees. So we all have
Mm.
to get a master's degree minimum, and we can always go further and get a doctorate degree if we desire. But at the
Mhm.
minimum, you need a master's degree. And most master's programs are going to cover certain angles and topics to make sure that you are getting foundation
Mhm.
for certain issues, ethics, professionalism, how to
Okay.
diagnose. All of those things are going to be
General,
really
more general
standard,
things.
just
Mhm.
pretty general. There's going to be some nuance. For example, social workers are going to get a curriculum that might differ slightly and be a little bit more advocacy related, community resourcing related, compared to maybe some degrees like licensed professional counselors or psychologists or even marriage and family therapists. Whereas
Mhm.
marriage and family therapists are going to maybe zone in and
So you
focus.
would wanna look for somebody who's a marriage and family therapist. Would that be more
See,
ideal?
that's a good one, right? But no, not necessarily. So
Mm.
our foundation is going to be similar. Our outside training beyond our degree is going to be what really you should look
Okay.
forward to, because some of us may move forward out of grad school and get more training that is focused on family systems,
Okay.
marriage and family systems. That's where we're going to focus most of our training, and that's what we're going to specialize in. Some are going to actually focus and zone in on addiction work, and they're going to then
Mm.
work in those settings and get more training. And that's where they're going to
Mhm.
probably also focus a lot of their continuing education credit, which is what we need to
Right.
sustain our license, right? So you're going to really want to look at where the training lies.
Got you.
And the specialization that they say they have. And
Well,
then
let
you
me ask
mentioned
you
something
this.
else.
Oh, go ahead. Go ahead. I got
Oh, yeah, I
excited.
was just gonna say, you mentioned something else that's really good though, because it has come up, so I wanna touch on it, and that
Sure.
is, do I need to have does my therapist, excuse me, did my therapist need to have that experience in
Yes.
order to best serve me? So, that's the one that I have really thought and, kind of wrestled with a little bit over time, because on the one hand, this is what I kinda have come to the conclusion on. There's gonna be some benefit to having walked the journey yourself.
Absolutely.
There are some nuances that happen,
Yes.
whether
That
it's
can't be
addiction
taught in a
work,
class.
disorder.
Yeah.
Mhm. Absolutely. However, there are going to be some things that will be different no matter what. So I am
Mm.
married. That doesn't necessarily mean that I now have a blueprint personally of what
Mm.
will help you. But as far as educationally and being able to have training, I can possibly help you, because the way my marriage runs may look nothing like how your marriage runs.
That's
So I
true.
may not be able to take examples. I can just tell you that, there are going to be some things that maybe I've experienced in a marital relationship, depending on how I run my marriage
True.
with my husband, that then may give me insight to help you. So it's going to
Mm.
be more about alignment.
So
If
this
the
is a
way,
good one. This is a good one. More about
yes,
alignment. This goes into my next
mhm,
question that I have for you.
okay.
Because I'm telling you all, those who are listening who's never experienced therapy before, or you experienced therapy and you felt like, oh, this didn't work for me. What I realize is that, like a relationship, there is a thing with chemistry.
Mhm. Oh
And,
yes. Oh yeah.
because, there's been times where boom, 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 looks great on the resume. Did
Mhm.
that, these class, continue to ease, but then the
Yes.
personality or
Mhm.
something you can't put your finger on is just not resonating. Or I've even had experiences where it was almost like two girlfriend to girlfriend. Like we're connecting at such a level that I'm questioning
Yes.
if you're really seeing my blind spots because
Yes.
I know you like me. And that's
Yes.
another reason why I went completely opposite as well.
Okay. Yeah.
So these are the real things that nobody's really talking about when it, because we hear we're in this wave of therapy. Everybody, needs to get it. But
Mhm.
I would love for this conversation to dive a little deeper of the things to be aware of and things to do. And it's okay if you connect with a person and you thought that they were it, but then as you go through the first or two sessions, it's just not gelling. And how do you know the difference between, you resisting because something in you needs to do more work, or it's just not, the chemistry's just not there. So
Yeah.
what does that look and feel like? Or how could that look and feel?
I think it's gonna go first toward, like you mentioned, there's just not that chemistry. I mean, because we show up, we're just human beings, right? So we have our own personalities, we have our own ways of relating, we have our different ways of presenting our ideas verbally, as far as communication. And there may be someone that you're like, this is not it. This is not doing it.
Yeah. And I
It,
can't
it
put my
may not
finger
be
on it. It's just energetically, it's
yeah,
just
it's just not them. They're not my cup of tea, right? Not
yeah.
because they are doing anything that is unethical, not because they're doing anything that's not professional. It's just that in this space where you are going to be vulnerable and you really are going
Yeah.
to have to form a connection, it just doesn't feel natural and easy.
Yeah.
It's not
Yeah.
organic. It feels like you have to do too much to connect in the way that is good for you as the client.
Yes.
And
Yes.
that may for you make it so that I'm doing so much to try to connect to who this person is as far as personality that I can't actually see what they have to offer as far as treatment. And that's
Right.
fine. That's
Yes.
fine.
And this is
No,
so helpful for you to even give permission to that, because I
absolutely.
really don't believe it's a lot of context around things that could happen once you do say yes to therapy. These are these,
It's right.
and so just to say, yeah, follow your instinct. That could,
Yeah,
that
it's okay. It's the same way you may go to a doctor's office and they know all of the things that are going on and they are able to present everything medically to you the way they're supposed to, but you just don't really care for their personality. Maybe
I think
something about the
what's
way they
different,
talk.
Camille,
Mhm.
is that, and maybe you can even speak to this. I know for me, I think a lot of times what feels different
Yeah.
is that you're wondering if it's you, because you're going, like, we're
Okay.
going to the doctor, you're going for your teeth, or you're going, for a physical. But then when you go for something like your mind, it's like,
Mhm.
am I
Mhm.
choosing this because dot dot dot?
Mhm.
Like, is
Yeah.
this part of my trauma, or is this,
Yes.
do I not want a male because I have a hard time submitting to a male because my father, abandoned me?
Yes.
You know what I'm saying? So it's really like,
Yes.
where is that fine line? Or are you saying that honor where you are in that moment? If that is it, and it's making you uncomfortable and
Mhm.
it's harder for you, don't create a situation that is going to create more resistance. Find someone that you can at least explore
Right.
that. Is that what I'm
Right.
hearing you say? Okay.
That's it. That's the nail on the head exactly. Because going to what you use as an example, let's say I'm finding myself resisting because it's a male and I have some issues with men that have been in my life and all that. Unless you want to come to counseling and resolve that as well, then don't make it harder for yourself. Now, if you're saying I'm purposely seeing a male because I know not only am I coming for work related stress, I also think I'm ready to dive into my issues with trusting men and some of the challenges I've had surrounding men. So I'm going to a male so I might be able to be challenged enough to let that come out. That's fine too.
I
But
love
just
that.
know, like you said, you can
Yeah.
create things for yourself. And if you don't want to then be talking about that right now, then go where you can stay focused on what is bringing you to counseling.
Is so powerful. I love that. And
Hmm.
that anchors in to what you were saying about knowing what you want. So those of you who are listening, I
Yes.
really believe that that is like a very powerful starting point before you even start looking for someone, because that just opens up a door of clarity. If you had to think of two other things when someone is contemplating on getting therapy or contemplating on, here's a big one, lean in for y'all. Y'all ready? Because this is another thing no one talks about. It's like, how do you know when that season is up? Like, for me, is I feel it. It's like
Yeah.
intuitive, but I don't know if there's like a general practice, or if that therapist should have a checklist to say, hey, if what you came here for, you feel like you're strong in that area. Like, how do you know that it's time to
Yeah.
shift? Because I don't know if this is
Okay.
a thing, but for me, it's
Right.
seasons. I get a different therapy depending on what season I'm in and what I'm needing. What are your thoughts on that?
I like to make that one concrete for my clients. What are we going to be working on while we're here together so that we have a goal? And that way, if you have met your goal, I will check in with you to say, and sometimes depending on who I'm talking to, I will say it softly like, this doesn't mean that we have to stop right now, but I will tell you,
Mm.
seems like you have met your goal for coming here,
Mm.
and then I'll outline why. This is what we've talked about, this is what you've done, this is what you've accomplished, you know, what are you noticing? Right? Because that
Okay.
way you don't have to guess. You know what you're coming for. And then as you share on your first session a little bit more of why you're coming, that helps you and the clinician to develop some things that you want to achieve.
What if
And
it's
then when
something
you've
more
achieved,
abstract, like confidence, or I feel like like what if it's more of like not a
yes,
finite? How do you what are your metrics to know when
but
they have
even in
enough
confidence,
examples? What is
yeah,
that?
even with that, something like confidence or more self-love, there are gonna
Yeah.
be things that change in your behavior because there has to be some shift because there's obviously something you're doing now that tells you you don't have confidence and you don't love yourself.
Uh-huh.
So when you obtain that confidence, when you obtain that self-love, things should change in the way that you think, in the way that you behave. And as we kind of notice those changes over time, that says, "Hey, internally, you're making some changes." Um, thought wise, you're making some changes. Now, all of our clients won't always recognize that because sometimes there's so much going on for people. We will share it with them, but we will still say that's an example of loving yourself. That's an example of protecting yourself. You're
Okay.
making positive progress. Yeah.
So even in that, I guess, and this is just me just wondering, like, I'm trying to give you an example of what that could be equivalent to, because there's always levels to everything.
Oh,
So,
sure. Um, would you
yeah,
like an
you
example
hit
of
it.
like,
Yeah, so like
yeah,
say for example, like if a
mhm,
person is coming, I love the self-love one. And I'll even speak to this for if you're in the corporate space. You have a client and they haven't gotten a promotion. They've been in space for like maybe 16 years, and they're watching people literally come in and
yeah,
get promotions time after time. And it's starting to mess up their mojo a little bit because they deliver, they and all the things. And they're wondering, like, is it me? What's going on here? Every company that I go
mhm,
to, it's like I'm not being seen. And so they come to you and they say, they think it's confidence. So they're coming to you and they're saying the goal is confidence.
right.
I don't know if it is. I mean, they're using their own mind, from the state
Yes,
of trauma, coming to the conclusion to make the goal. And
right.
so, you take the goal that you say that they feel it is, and then it's like, who decides? Oh, 4 incidents of showing confidence, or when you get that promotion, finally, that's you've arrived. Like, how does that process work so that therapy
Mhm.
can be truly an efficient and effective solution for someone?
That's a good one. So, in that example that you gave, that not getting the raise, noticing other people are being promoted above you, and then saying, okay, well, how do we know we've reached confidence? Is it like one example of me maybe showing some confidence, or two, or three, or four? Well, first, we would back up to look at what is it that's going on with them that lets them know confidence is an issue. We would then kind of go into that a little bit more. Maybe what we would find is that underneath that, they have had some experiences in life where they are not feeling comfortable with their voice being heard or advocating for themselves.
Right.
Maybe that part has been crushed a bit. And so then what it would look like is recognizing that a part of loving ourselves is also having the confidence to advocate for ourselves, to protect
Mhm.
ourselves when we feel as though things are not being done fairly or equitably across the board. And so,
Mhm.
in that particular space, it might look like crafting, helping them if they don't have the words, but developing some wording
Scripts or
or an
mhm.
email in order to first inquire, helping them because I also have had clients who are first generation as far as education, as far as corporate level that they've been able to get to, and they don't really know the lay of the land. How do you
Right.
go about even addressing this? And so then once we actually get that wording, then the idea is then feeling comfortable enough that you are worthy enough to be protected. You are worthy enough to be
Mm.
advocated for, just like
Mm.
anybody else. And once they get
Mhm.
to a place where they can then go inquire and they feel not so nervous and wrecked and like, oh my goodness, this is the end of the world. I should have kept it all status quo. I should have kept the peace. I should have not said anything. Once they
Mm.
get to a place of recognizing, and we can actually keep track of that verbally by them telling how their days are going, how they are exhibiting this self-love, self-protection, confidence.
Mhm.
Then when it starts to become a normal part of the way you walk, not just in the workplace, but in the personal spaces, with friends,
There
with
you go.
family, with
Yes,
people out and
integrating.
about,
Yes.
then we
Yeah.
say, "You're achieving it," right?
Yeah.
It's not
It's
just
become a part of
conceptual.
who you are at that
Absolutely,
point, and that's the
absolutely.
thing, and I love that, and that's
Mhm.
why and maybe that's what I mean when I say I feel it, like, I feel the shift has come, it's like I've stepped
Okay.
into that becoming,
Yes.
and so now intuitively, I'm like, "Okay, cool, what other therapists, what's next?
Yes.
What is the next thing that I need to
Mhm.
really, sharpen?"
Absolutely.
And so I don't know, for those of you who are listening, been considering a therapist, and a lot of times, and honestly, therapy and coaching, they can commingle. They're not supposed to legally, they're not supposed to
Mhm,
happen. But I
mhm.
always inspire therapists to consider becoming a coach, because there's so much more you can do without all the red tape that
Mhm,
the
mhm.
the
Yeah.
the practice requires. And then you're able to go and use your gifts and your experience in a more deeper and a more implementive type of way that can get really
Mhm.
exciting.
Mm.
And
I just
so,
always say coaching is kind of like our solution focused equivalent, because you're not going to go too far back into like family of origin, childhood type of things. You kind of are going to keep it, maybe recognizing, hey, there's something back there that contributed to where I am, but we stay in
right.
the here and now and we stay in the future goals that we set.
Right. Okay, I love that. So that was really good. I never heard it said that way. To
Mhm,
just clearly differentiate what would be the difference
mhm,
between when it's time to get a therapist or coach, or have both, and why
mhm.
it would be beneficial to have both. So when you are thinking about a therapist, you are preparing yourself for that more in-depth work, that more
Yeah.
answering
Mhm.
the why behind the behavior. And then
Yes.
when you're looking at the coaching aspect of things, you've kind of gotten yourself to a place where you're like, okay, I know who I am. I'm understanding where I am, how I got here. And now I'm looking at where I'm going in my future and how that person is going to help me there. I
Yes.
love that so much. Thank you so much just for the perspective. I love that when we spoke, you mentioned about your work being so profound and so impactful, that you've had other therapists that have
Mhm.
just that you've attracted, really, that want
Mhm.
to learn more about how you're integrating this faith piece, and what this walk looks like. And so tell us more about that, and some of the value that you're offering for people who are already in the therapy space.
Absolutely, thank you. That kind of was born out of, I think, just a misunderstanding of whether
Mm.
faith actually belongs in the therapy space. Matter of fact, funny enough, just today there is a conversation going on in an online space about that very thing, and so
Wow.
and so there's a back and forth discussion
So what is the big,
between.
what is the big,
I
elephant
know
in the
that.
room that everybody is just not? Because to me, it just feels so, like,
I
understandable,
think
just clear.
Honestly, I think it's just our training. I mean, I was
Okay.
secularly trained. I remember that in my graduate program, we were to leave ourselves at the door and we were to fully lean into our client and whatever their worldview was. I can even
Okay.
remember talking about maybe even sometimes in order to kind of bridge a gap or form good rapport with a client. One professor even advised that you sometimes mimic some of their language, some of their mannerisms,
Ah,
and things like that,
yeah.
to just kind of have more alignment. And it's funny
Yes.
because, like, years later, I thought about that when I was in a session. I had a client who they would use all kinds of colorful language, and they were a real cool client. But what they learned was that's not necessarily the way that I communicate. And so when I would summarize some of their thoughts, they'd throw
Yeah.
some extra colorful things in just to
Yeah.
see how
Yeah.
I was gonna
Yeah.
summarize what they said,
Uh-huh.
and it was funny.
So
I,
how did you do it? How did you pull it off?
I would just overall thought. So let's say they were talking and it's colorful, 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 and I would then say, it's sounding like to me you are having a struggle with the way this individual is not hearing you or not
Yeah.
protecting you or whatever, right? And they said one day they just came out and said, and they were like, "You're going to skip all the curse words, aren't you?" And we just kind of laughed. I said, that's just me. And they were like, I know, but
Yeah.
they would still try it, and
You know
that's
what? That's cool. I love
yeah.
that. You
And I
know?
think that's the part that for some of us we don't know how to conceptualize the fact that we can actually be ourselves, still build genuine caring, genuine connection, serve well, ethically, professionally, and our clients can still get something great out of it. And so that's a part of what I help clinicians to understand. What does it look like to even serve clients who don't believe like you, have a whole different worldview? How do you move forward if what you want to do is have some more of a specialization of your own faith base in the counseling session? And it all honestly starts with informed consent. It does, because I have
Yes.
served
Yes.
clients
We're
from
all
all.
adults, right? Like,
Yes, it's
yeah.
informed
It's a
consent.
conversation.
Um,
Yeah.
and the informed consent starts ideally before they get to your door. Your website is clear. If you're on any directories, that's clear. And not clear as in, and I think this is where it gets a little sticky. People are very used to the way they see faith and religion shown in the world. And
Mm,
sometimes have very negative experiences or views with the way people are treated in the name of faith. And
absolutely.
and so what we get to, since our focus or my focus through Christ in private practice is on Christianity, the
Hmm.
idea is not what someone says, their opinion and that person's opinion and my opinion, but what does Christ say?
Mm,
Because you may have been treated poorly by somebody who was a Christian. You may have been treated poorly by someone who was a man. You may have been treated poorly by somebody who was certain culture, race, and all the things. But what at the foundation, if we're going to use our faith, and if it for me, and I know other business owners may have different faith alignment, but for me, it's going to go back to while people may have had some bad experiences, and we definitely want to be sensitive to that, this is the
mhm.
way that you can bring Christ into your private practice ethically, professionally, without having to compromise your faith. And
Right.
so
So
then,
what it seems like is that you're making Christ the standard.
yes.
And
Mhm.
so
Mhm.
the understanding is if you want to make Christ the standard, then okay. So let me just throw a curveball
Yes.
and get your thoughts because this is just real raw. You all that listen to me, you know that sometimes I intentionally
Yeah.
do this to the guests because I gotta keep them on their toes. You
That's
know,
fine.
so just bear with me because
That's good.
I can understand so many ends. And I even
Mhm.
had a business partner years ago. She didn't know what my faith was, and I knew that her faith wasn't the same as mine. But we were working on a project that was bigger than all of that. And what I mean was, it wasn't bigger than God or bigger than Jesus or whatever we believe,
Mhm.
but I really believe that there is a level of humanity that we haven't accepted, that there's so
Mhm.
much more that we have in common than that we have apart. And I
Yes.
believe that it gives us such a great disservice when we spend more time focusing on what's different and what's not than we do on what's similar. And it just
Mhm.
sucks the love out of
Mhm.
relationships, like literally sucks the love of the
Yeah.
humanity and it just creates this disruption that is so opposite of peace. And so my thing is this: we say, okay, well, Christ is the standard. Even in that, when you are walking with someone who say their faith is not Christ,
Right.
then
Mhm.
do you make their standard the standard? Then what? So is it the thought that if you are a Christian, then you have Christ-like standard? Because to me, I have seen so
Mhm.
many people who are not Christian that still have Christ-like standard. I've seen
Mhm.
people who are
Mhm.
Christians that don't have Christ-like standard, but they're calling themselves
Mhm.
a Christian.
Oh,
Let's
yes.
talk about it. You know?
Okay.
So
Let's jump in. This is
yeah, let's
good because
jump.
the things you're asking, people have questions about it. That's, I think, part of why people don't feel so comfortable with faith integrating into the psychology or the counseling room, because they feel like then you're gonna be biased. How, this is just gonna
Yeah.
be your particular, and what about everyone else? So here's what I would say about it. Christ is the standard, but everything that I know about Christ based on his word in the Bible does not conflict with not one ethical code. Not
That's
one.
the key. So
So
go ahead.
his standard doesn't conflict with ethical
So
codes. It
why
doesn't
is it even a thing? So you see what
be
I'm saying? That's my
yeah.
whole thing because that's why I can go in relationships and no one even I don't even have to say it or know it
Yes.
because it's the same essentially.
So here's
Love
the
all,
reason why.
treat your neighbors kind, do it unto others as you want. Like, these are like basic,
Yes.
you know, standard life stuff.
But here's the difference. When our clients come, there are some clients, because Christianity is one of the largest religions in the United States.
Mm-hmm.
And so when clients come, some clients want to know that how you advise me is not going to cause me to come out of alignment with my faith. So they actually want someone who understands their faith
Mm-hmm.
and can provide them with mental health care that actually goes along with their faith. And then sometimes they actually want you to help them with maybe scriptures or word that is aligned with their faith. Let me
Okay.
give you an example. So
Got
I
you.
have,
The
because
reassuring. The
yes,
reassuring.
mhm.
Yeah. And also I
So
can see the trust being anchored more with the
absolutely,
person because they feel like, no, the stuff you're giving me is not just I need to know that this is biblical. So that
yeah,
reassuring that I'm in
right.
alignment.
So
Got you.
they're already coming, and they
Got
know
you.
their faith well. And well,
Yes.
and I'll say there are some people who come, they know well enough that they don't want to come out of alignment with the God that
Th-
they serve,
Got
but they
you.
don't know all the scripture. And when you
Got
start going into
you.
different treatments and things you want
Yes.
clients to try and think and do,
Yes, you
they
wanna
want
make
to make
sure
sure.
that it's in
Mhm.
alignment with what they believe.
Now
Got it.
here's
So it's almost like that
another thing.
safeguard.
People say, "But what about everyone else?" Like, so that, because that's
Mm,
where they get, they still get very sensitive, and they're like, "Yeah, well,
mhm,
that's great, but then so are you saying you just turn everybody else away?"
mm,
Mm-mm. No. No, you don't actually. Now there are some, clinicians that is their specialization, is to
mhm.
operate within their faith, so everything that they offer is going to be Christian counseling. So if
Right,
if you're going there, then you just automatically know that's what you're gonna get. For
right.
everybody who sees individuals who are aligned with their faith or not, that
Mhm,
is where you actually have to properly make sure that you're advertising properly so people know before they come, this is what I'm going to get out of this clinician. So on my
mm,
website, it talks thoroughly about what it means and can you come if you don't believe? And the answer is yes.
mm,
Yes, you can come even if you don't believe
mm,
in Christ. And I've had
mm.
clients, and I have clients who don't believe in Christ. And
Me too.
I've had,
I've had
yeah,
several clients. I attract people that do
hmm
naturally,
hmm
but because of how I am, I've served clients, and honestly, it's not that huge of a difference in the
no,
experience.
well, let me tell you some things that make it different. So
Mhm.
I believe in mind, body, spirit. I
Mhm.
believe that when a person comes into my counseling room, they are bringing with them their body physically, their body mentally, their body spiritually, and the
Mhm.
physical goes to medical. So sometimes
Mhm.
something that you are presenting in my counseling room actually is not as much mental health as it might be a physical ailment that you need to go and see
Mm.
your doctor about. And I've had
Mm.
clients come back with everything from Hashimoto's to non-existent estrogen to other things that
So the
upon
type of practices that they choose may not be in alignment with what a
Mhm.
Christian would choose. So that's
it,
where
it might not, so, but here's the thing, you may also have a clinician who doesn't necessarily see that holistic approach. They are just mental health.
okay, I
So
got
when
you.
I am sitting with my clients, I know that it could be strictly mental health or it could be a combination. It could be a medical issue, mental health, a spiritual issue. I've
Got you.
had clients come into my practice where I remember one time specifically, I stopped and asked, let me ask, because Holy Spirit was putting it on my heart. I said,
Mhm.
have you participated in any types of spiritual practices where you were conjuring up, inviting, asking spirits to help you in some way? turns out that the person had. Well, what they
Mm.
had been participating in on a spiritual level aligned with their belief at that time. They no longer had that belief, but it was something that they had tried for a period of time. And from it, they were
Wow.
having challenges that
Wow.
were associated with
They had opened
stress,
up portals that they didn't
fear.
even,
Yeah,
yeah.
they were having fear, they were having stress responses, they could not look in mirrors, they were having things going on at night, they were having
Mm.
challenges passing by things that resembled Christianity, they could feel an
Mm.
agitation, and we already knew we were of different faiths, so I asked them, I said,
Mm.
"According to your belief system, do you have a way to put that back in its box?"
Wow. What powerful.
Mhm. Yeah.
Let's just land the plane right there. That
Mhm.
just according to your belief system. So like for me, that's real powerful. That one statement because what that
Mhm.
does is it honors that
Mhm.
person and where they are.
Mhm.
I've
Yeah.
seen people start and all kind of things they've experienced, just trying to find their way and end up on the tail end, maybe finding Christ on the end of their
Yeah.
journey or in their 50s or whatever the case
Mhm.
is. But if that is a person's journey, it feels so refreshing that as they meet people along their path, that those people will honor where they are in that moment.
Absolutely.
And if
But
that
does it
moment lasts 5 years, 10 years, whatever, but I love that.
yes,
Do you remember that question again? Based off of what you
yeah.
believe.
Based off of your belief system, do you have a way to put that
Mhm.
back? Yeah. Yep.
That's really good because that puts them back in the driver's seat of their life. And honestly, can even open up a like, oh, no, I don't. Like, okay. That could create
Yes.
another, you know,
And they did have to
open
do some research.
opportunity.
That was
Yeah.
something that led to it, and they know, or they knew that we didn't share the same belief system and that the way that I knew was not going to be something they could use. And
Mm.
I said, well, you'll need to do some research on that because the only way that I know
Wow.
is according to my belief system, and
Wow.
that uses Christ. And I know that's not comfortable for
Yeah.
you, but if you could do some research, because I think
Wow.
what we're talking about here is a bit spiritual and it's impacting
Wow.
your mental health.
Wow.
Mhm.
Wow.
Yeah. So but that's how it's like, okay, so what about everyone else? Well, everyone else can still come as long as we
Yes.
understand we can be respectful of the
Yes.
fact that this
This
is
is
my
where
worldview,
this is
this
where
is
I
your
am. I
worldview.
can't
Yeah.
lose myself to serve you. I have to stand in my authentic self while you
Mhm.
stay in your
Mhm.
authentic self. I
And
love
that's
that
why
so
I
much.
and that's why I have Christ in private practice to help clinicians understand how do I do that? How do I navigate that?
That's
Exactly
good.
what you said. I can't lose myself. And here,
To
according to my
serve you.
belief systems, I can't lose my salvation. I can't like turn my
Right.
back on the God I serve
Yeah.
just to serve
To
you.
serve
So how
you.
about yeah. So how
We
do we do this so
honor
that
each
I get to feel
other's.
yes. Mm-hmm.
Honestly,
Absolutely.
I just to me, that is the way I love, live, and lead. That is peace-driven leader at its core. That's
Yeah.
it. We
Yep.
we are because imagine you see what you just described, how peaceful that is.
Mm-hmm. Mm-hmm.
That is mutual respect, mutual honor, and you're challenging
Absolutely.
that person. Hey, you go, find that, and do that work.
Yes.
And who knows, as they're going, and they may find some holes in their system, and now
Yes.
they're open to a new system. That's how
Yeah.
it's supposed to feel, in my opinion. I really believe
Yeah.
that is it. I love the work that you're doing. I think that
Thank
it's
you.
incredible. And for those who are listening, I just want you to know that their therapy is, and I will advocate for therapy to the day that we
Mhm,
go home to be
mhm,
with the
mhm.
Lord, because I've known what it has done for me personally, what it still does for me to have
Yeah.
someone. And the more you're able to come outside of your own way and give me fresh perspective and to honor where I am, the more impactful and effective my experiences has been. And that's why it doesn't matter for me as much as far as where their
Mhm,
relationship is,
mhm.
because I'm so anchored in my faith and I know how to take the word and process it through the word, take things
Yeah,
that I hear. I'm matured in that area because I've just trained myself. And that's how, I mean, I
yeah.
was at a training in Vegas this weekend, and a guy said, "Hey, this is the best book I ever read." And it was a Mormon book. I was like, "Oh, okay. This is the story of
Mhm,
Jesus. You're
mhm.
going to, you know, I
Yes.
get that often, and I don't shut people down. Oh, no, I don't do that. I'm not gonna even, because
Right.
I'm so confident in my faith that
Yes.
I'm open. You know what I'm saying?
Yes. Well, and
To
here's the
walk
thing.
with people.
I can hear whatever it is you're bringing. As long and again, as long as you are informing your clients honestly and transparently. Because I have had some clients, I've had at least 2 who were looking into Satanism, or they had performed some type of thing along
Wow.
the lines of Satanism. I'm not going to
Wow.
be able to read the book of Satan though to better understand
Right.
it. Now I have done some research just to understand some things along that lines so that
Right.
I understand how are we, moving forward? How are they moving forward? What is it? But no, I'm not going to. I just had someone recently who
Right.
was even bringing up the fact that they were there was some things going on, and anyway it boiled down to they found out this person was reading Satan's biography. It's like, okay,
Wow.
well, I'm not going to be reading Satan's biography. But if that is what the person
Right.
is going to be reading, then still we're talking about what is it that you're gleaning from this, and what
Wow.
has you, kind of interested, and then what are the effects that you are receiving, right? So
Yes.
that's and the reason why I say that is because I think what happens as we are having this discussion about faith is that sometimes people will feel like, well, why can't you be open to all faiths, but they stop at certain ones? So
Yes.
so it's like they're all good with certain things until we get to the Satanist
Yes.
book. Um,
Mm.
well, why are you stopping there?
And this is
And
what I
and
say.
so it's like
You don't have
like
to stop there. And I love the way you still don't stop there, because I walk through the valley of the shadow of death,
mhm,
right?
mhm,
I will
mhm.
fear no evil. And so for me, it does not matter. I
Yes.
am so grounded in who I am
Yeah.
and whose I am, that it does not intimidate me or make me feel like,
No.
and
No, that
and that's powerful.
doesn't in any way intimidate me. Not at
Yeah,
all.
that's
Not
powerful.
at all. But I'm not going to join into it because the Bible also says you are not to test the Lord your God. So I'm not going to be
Right.
like, okay, well, let me just start also, diving into some of the practices that you're doing just to better understand you. No, 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 no. I'm
Right.
not going to do that because the
Right.
spirit realm works on agreements. That's how the
Yes.
spirit realm has always worked on. So things don't
Yes.
have power unless you come into agreement with them.
I love that so
So there's
much.
certain things I'm just not going to be able to come into agreement with,
And that's
but I can
okay.
absolutely have you in my practice and we can absolutely
I
hear
love
about
that.
what you're experiencing and then move forward based on what it is that you
I
might be
love
struggling
that.
with.
I love
Yeah.
that so much. You all, listen, if you needed a handbook on how to show up in a world that is filled with all different types of faiths and still be
Mhm.
grounded on who you
Mhm.
are, this is a phenomenal podcast to listen to. And this expands beyond the stuff we talk about. If you listen to these podcasts enough, you'll start to train yourself on how to think in a system and expand these concepts over your work and your life. This is the conversation that exists in corporate. We're in corporate cultures where there's people that believe everything.
Yeah.
Everything that Camille discussed today can be used in your corporate setting. Everything she discussed today can be used in your home life as you have your children have different viewpoints, because as they get older,
Mhm.
guess what? We hope that they choose, we
Mhm.
want, but they're out there, they're experiencing different things, they're learning, and they're picking up different ways and beliefs and feelings. And we have to keep this, it's almost like this grounding is what you shared today,
Mhm.
so that you can serve without losing
Mhm.
yourself. I
Yes.
love that
Yeah.
so very much. You can still say no, thank you. I still love you, and we still can have
Absolutely.
conversation. We still
Mhm.
can connect. But I'm
Yes.
not going to read this book that you gave me. I'm
Yeah.
not going to dive into this that you're in. That's what you want to do,
Mhm.
and that's you.
Yeah.
And just like you have your space to be that, I have my space. And I believe that this world, that right there, that's peace driven leadership at its core. And if
Mhm.
we just continue to move and flow in this society, where would this world be?
Yeah.
Where would this world be? How many problems would we avoid and dismiss and completely, avoid, because we are walking in this way?
Mhm.
To me, it's the epitome of love, God's love,
Absolutely.
because God manages to love us all,
Right.
despite all of
Right.
our ways.
And
So
he's
it's a
patient
great
with
mirror of
us.
Him.
He
Yeah.
may not co-sign on
Yeah.
everything we
There
decide
you
to do,
go.
but he's
But
he's
He's with you.
patient. Mhm.
Yeah, he'll
Mhm.
right there with you. And I just shared that with my husband, something similar. Because sometimes, well, I mean, God allowed that. Well, he didn't mean he condoned it. right? He
Right.
was there. Yes, he was
Okay.
there. But that don't mean, like you said, co-sign the decision. And that
Right.
and that feels so good because we're in his image, so it
Mhm.
makes sense to move in that way,
Yes.
right? And I feel like that's where we lose we lose the assignment. It's
Mhm.
convoluted whenever
Yes.
we feel like we got to just like, oh, you're selling out. Oh, you're not.
Mhm.
No, things aren't
Mhm.
just quite that
Right.
black and white. Yeah. So
Right,
thank you so
absolutely.
much for coming on. What would you like to leave the people? If you had to say one thing that you just wanted to put on the hearts of others, what would that be?
Just continue to do the good work that you have been placed on this earth to do because
Mhm.
so many people need the gifts and the talents that you have been given.
That is awesome. Listen, you heard it firsthand from Miss Camille. You can carry it. There's no having to choose. You can have both. It's not about how much you are carrying, right? It's about how well you carry it. And so if you are getting these circles of accountability and you're getting what we call a pro team, that's professional help, a therapist to help with that mindset, right? Somebody to help with your wealth creation, someone to help with your health. You need professionals. Stop trying to piecemeal this stuff and figure this stuff out on your own and come in agreement, like Camille said, with professionals who can guide you along your journey. That is how you live in a peace driven life. That is how you truly show up, crushing it and being able to really dominate in your sphere of influence because you are not leaning to your own understanding, but you're aligning with people who have the same core values as you are, but also they come with a level of experience and insight that you don't and help you level up. This is how you live. This is how you love. This is how you lead the Peace Driven Leader way. Thank you so much, you all, for listening. Much love to you always. I look forward to seeing you next time. Remember, Peace Driven Leadership is not something you find. You'll never find it. It's something you create. And you can create that right here with us in the Peace Driven Leader Lounge. Until next week, bye bye for now. Awesome. Good
All right.
stuff. You did so good. I know I was throwing them at you.
Yes, and I'm so glad you did because I really and truly, I'm like, good. This is the stuff that people are, they
Need to
get antsy when they
hear.
hear you about, talk about that stuff, and then they're like, yeah, but what about? And what about? And you threw those out there
You
so that
know?
people could
And
understand.
you handled it so sober. And so, like, I love your demeanor. It's like, because some people, the problem is they mess up because they get too passionate. They get so,
Yes, yes.
and then it's like, whoa, never mind. It's okay. Nobody wants to even. And so you're like, oh, good question. I'm glad you asked. That's
Yeah,
it.
because there's a lot of hurt and harm that people have
Yeah.
experienced, and I think sometimes people are so used to feeling like, well, if we don't do it your way, then
Yeah.
we're wrong. And it's like,
Right.
but going back to the Lord has had so much I know He's had patience with me, and so
Mm.
and that same thing is if the Father will wait
Mm.
decades
Ooh.
for you to choose him. Why am I getting all bent out of shape? And we only
Ooh.
meet for 50 minutes? I think I can calm down. Like, I mean, like I think we can go ahead and just take a little example from the Father and all you gotta do is stay in your lane. The Lord always stays in his lane. He's
That's
not gonna
true.
be drawn too far to the left or to the right.
That's
You can't do
it.
that with him.
That's it.
But if you decide that you will not like to know more about him, he's there. And if you don't, he lets you on your way. He
That's
lets you
right.
decide.
That's
So
right.
I'm not going to get combative with people and
Yeah.
start and get nasty and everything because there's enough of that in the world. And
It
the
is.
truth of the
Oh,
matter is
man. It's enough
people
of that in the
will
world.
my thing is, Father, let the people come who need to come. Matter of
That's
fact, I'll
it.
tell you, I'll just only take less than a minute. But I have a client that I've been seeing for many years now, and they have a belief, kind of. They didn't grow up with any belief system. They're in their 50s,
Mm.
and they had asked a question because they do happen to see a medium, but they have beliefs. Anyway, they have a lot of things going on, and there was an opportunity for me to just kind of share a little because they asked me something as it related to the medium,
Mm.
and then that was that. We left it alone and kept on moving.
Mhm.
Years, at least over a year later, they
Mm.
were told by this medium that they could also do the thing that the medium was doing. And the medium said that they were Christian and that they helped spirits pass through and that the client could do the same thing because they also have a sensitivity, which my client does have a heightened sensitivity to things that cannot be seen, but they got nervous. They didn't know what that all meant. They weren't sure. And they brought it to counseling. And they said
Mm.
it, and I said, "Thank you, Holy Spirit." They said, "I remember you said though that you don't consult the dead or you're not supposed to do that or what I'm not sure. I don't know." And I said, "Okay, well, maybe it's better if since we're talking about a faith-based thing," I said, "Don't take my opinion, don't take his opinion." I said, "But do you just want to know what the Lord says?" And they were like, "Yes, that would be really helpful." So I gave them a couple scriptures, let them read it. They were like, "Thank you so much." Because what's relevant to that
Wow.
is this individual's memory is not good. They have an illness that impacts their ability to remember things long term. So the fact that that was brought
They
up,
remembered that. Even if they remembered.
they can't always even remember the last appointment we made. That's
Ah,
that's how serious it is. Yeah. They can't always remember what they told me. Sometimes they start repeating things at certain times. So the fact that I was like, "You
I
remember something from
remember
over a year
God.
ago?" And I'm
Yeah,
like, "No,
that was
that I
God.
believe you had some help." I was thinking
Yeah,
it in my mind. But I say all that to say, in our
yeah.
patience, in our walking with people who may not believe like us, who knows when on their journey they say, I just wanted to ask a little something about,
Yeah.
you had talked about, or
Because
I
you
have,
created
and
safety for that. You created
there you
safety
go.
for that conversation. Yeah.
And so if you want to find out, I mean, you can ask, but that's not what they come for.
Right.
But when they needed to know, they asked. And then it's
Yeah.
like, well, if that's all that the information they needed, and that's the first time they ever got some scriptures laid out for them to look at, then all right, Lord.
And that's it's and the God tells us to, that's why I tell people all the time, that's above my pay grade. I just do what the Holy Spirit tells me. And then that person goes back, the scriptures you gave them, right? And
Mhm,
what I envision is like God, like you pass the baton.
mhm,
Boom. Now they're in their own situation. I even feel God now. And God does what God does best. Just like he did when he dropped that in their memory. That's a scripture. I bring
right,
things to your memory. That's a scripture. So it's like he's doing what he does,
right, right.
regardless. And so we don't have to help him in that go to the
No,
next and like I said,
right.
that's above my pay. I'm just gonna do what I feel aligned
Mhm,
with the Holy Spirit is telling me in that moment and love people, meet them where they are, and then let God do the
right.
converting.
Hello.
Let him do that. Let him do that part.
Okay.
That's what he does best. Same with the converting. They make like you said, make convert 5 years, 4 years. Hey, that's on him and that give me God.
Right.
So it just keeps it simple for me.
Yes,
And it just yeah. And
absolutely.
I thank you so much. I don't find many Christians who understand and get it at a deep
Mm,
level the way you did and the
okay.
way in which and how you did, not just what you did, but how you did it. I personally have an experience. So I just want to say continue to show up the way you
Thank
are and your conviction for what you believe in such a loving way and such
thank you.
a welcoming, open, yet convicted. It's the best of both worlds. It's like you're lit in the way in which you
Mhm,
do it. I can see why
mhm,
God has called you to teach other people because it
mhm,
truly is a
mhm.
gift that a
Yeah,
lot of people cannot grasp. And
yeah.
you dance with it so well and it makes you very powerful for the kingdom of God. And
Thank you.
so continue
Thank
the
you.
work. I actually have a client that I want to connect you. I'm going to send her our podcast.
Okay.
And she is a mental health therapist. Actually, I'll meet with her at 3 and I'll share.
Okay.
I'll just share. Mention you so she can follow you. But she just wrote a book on faith, integrating faith and mental health. And so
Oh,
I feel like you all would just have a
yay.
lot, just to talk and to see where
Awesome.
it goes, maybe podcasts
Mhm.
or whatever. But
Yes.
yeah, her name is
Wonderful.
Dr. Cox. Yeah, Dr. Cox. And
Okay.
so yeah, so and that's what this is really what we do is what I'll do, and you'll find this with me, Camille, is that God has created me to be a conduit to like connect people and to refer, you know?
Okay.
And
Yes.
so
Yes.
what I wanted to do at first, it was just like, oh my goodness, how am I going to grow my business if I'm always giving business to other people? And so I had to learn to create a business model that allows me to be able to benefit whenever I share and make the connection. And so we
Yeah.
have a referral partner program. So if you're interested in that, I would love to send that to you through email for you to take a
Okay.
look at it, see if it's, if it sounds interesting. At the very least, I would love to hop on a call after you look at it so that you can ask me
Mhm.
whatever questions came up, because that's going to help me refine the proposal even
Okay.
more. You know what I'm saying?
Yes. Yes,
So,
absolutely.
yeah, so definitely do that. I'll have my team to send that
Okay.
email with a call. Be 15 minutes. You just kind of sharing your thoughts on it, any questions that you have, because I am on a very specific assignment, and I have 8 referral partners, and I want them to be people
Yeah.
that think like you, because
Mhm.
we're gonna be bringing a lot of people into the app, and they need to be
Yeah.
assigned to people, and I want
Okay.
them to be assigned to people that's open and that's gonna hear from the Holy Spirit, a spirit led.
Yes.
And you know what I'm
Mhm.
saying? So this
Yes.
season of my
Yes.
life is so important for me to make sure that I bring those people on in the onset so that I'm a good steward
Mhm.
of what I
Mhm.
built through this app,
Right.
right? Because I don't do coaching or anything like that anymore. I speak. So I want to make sure that the people that are serving them, are in full alignment with my values. And you just hit it on the head. More people need to know you exist.
Thank you.
So
Thank you very much. This is good.
absolutely,
Well,
absolutely. Well, you enjoy the rest of your day. I know you have a hard
you
stop at
too.
1. Much love to
Yes.
you, and we'll
Thank
be in
you.
touch. Look out for my email.
I will. Thank you.
All
Have a
right.
wonderful day.
You too.
Bye-bye.
Bye-bye for now.